Good morning. I'm going to be doing head-to-toe assessment with my patient today. The first thing I do, I look at the chart. I look at the patient's medical history. She had an appendectomy 3 days ago. I will look at the medications that she's on. Before I go into the room, I look at any signs that on the door for any precautions. Good morning, Svetlana.
Good morning.
My name is Claudia. I'll be your nurse today.
Sounds good.
I'm going to be doing a head-to-toe assessment with you.
Okay.
Yes?
Sounds good.
Can you go ahead and tell me your name and date of birth?
Svetlana Semenova, December 4th, 1986.
Perfect. Thank you. Did you have your breakfast already today?
No, not yet.
Not yet? Great. Okay, we'll make sure that you have it. And how is your wound? How is your pain level today?
It's tolerable. It hurts more when I move, but otherwise it's okay. It's not too bad.
Great. Okay. And what is your tolerable level?
3 or 4.
Excellent. So the first thing I do when I walk into the patient's room, I make sure the patient is not in any extreme distress, especially pain, since she just had a surgery. I will assess for any tripping hazards, any lines that she has, to make sure trace the lines, make sure there's all my emergency equipment, the ambu bag, the respiratory equipment, the Christmas tree, as well as the suction. And if there's any equipment that's missing, I will make sure that I'll bring it and that is available for any case of emergency. Svetlana, I'm gonna go ahead and take your vital signs. I'm gonna take your blood pressure. What is your baseline blood pressure? Do you
Like
know?
120/80.
Perfect. And this arm is okay. You don't have any IVs. Have you had a mastectomy?
No, I didn't have
Great.
anything.
Thank you. Go ahead and take the patient's temperature. And as I do the temperature, I'm assessing the mucus inside the mouth. Make sure that it's nice and pink and moist. Perfect. Your temperature is 37.2. I'm also going to go ahead and look at your oxygen level.
Okay.
And then I'm gonna go ahead and take your pulse. And as I'm taking the pulse, I'm observing the patient's respirations. That's perfect. And oxygen is 98. That's wonderful. And your blood pressure is 120/72. That's
Okay.
great. Thank you. Where's that pen light? Perfect, found it. I'm gonna go ahead and look at your eyes, Svetlana. I'm gonna shine a light. I want you to just look straight at my forehead. And I am looking for pupil size. Make sure they're round or equal. And just keep looking at my forehead. Perfect. Now go ahead and look at the pen. And then just keep following it. Keep looking at the pen. I'll go ahead and look at the ceiling. I am looking for accommodation, and then go ahead and trace the pen. That's perfect. So can you tell me your name again?
Svetlana Semenova.
Perfect. And what is the date today?
This January.
Wonderful. And where are we, and what brought you here today?
It's Grossman Hospital, and I did have appendectomy.
Perfect. So my patient is alert and oriented ×4, and during this assessment, I am looking at my patients to make sure that their speech is coherent and their behavior is pleasant. I'm gonna have you go ahead and smile, Svetlana. Raise your eyebrows and puff up your cheeks. Frown, and then stick your tongue out straight. Perfect. So there's no deviation of the tongue. She has facial symmetry, and I'm also assessing her. I'm looking at her neck. She doesn't have any tracheal deviation or any JVD. I'm gonna go ahead and look at your head, and she doesn't have any pressure ulcers. It is round. There's no deformities. It looks good. Have you had any head injuries?
No.
No. Any headaches? Any problems
No.
with memory or coordination?
No.
Perfect. I'm going to go ahead and assess I'm gonna assess your heart. So I'm gonna go listen to your heart. Do you have any heart problems? Any
No.
heart murmurs?
No. I don't.
Palpitations? No. Perfect. And you can just breathe regular. In a regular patient, I will go ahead and make sure that I put the stethoscope on the bare skin of the patient. here I will go ahead and listen for 60 seconds for the apical pulse and make sure that there's no murmurs and the heart rhythm is normal. Svetlana, do you have any shortness of breath, any problems breathing
No,
when you're
I
walking? No?
No.
Do you have any history of smoking
No.
or lung problems? Perfect. I'm gonna go ahead and listen to your lung sounds now. And for the lungs, we listened in the front and we also listen on the back, and I'm gonna start with the front. And just when you feel the stethoscope, just go ahead and breathe normally. And we're doing also this on the bare skin of the patient. Perfect. I want to listen to your lungs in the back. Could you roll to your side, please? Thank you. When we listen to the lungs in the back, we start at the bottom. In case there's any fluid, we want to know how far the fluid has gone on the lungs. Just go ahead and breathe normally when you feel the stethoscope on your back. Perfect. Thank you, Svetlana. And there's no crackles, no whistles. The lungs, the sounds are clear. And Svetlana, now I'm going to go ahead and assess your abdomen. Have you had a bowel movement, and was it formed?
I did, yes, it was.
Yes?
Yeah.
Perfect. Have you had any like mucus on your stool, any blood,
No, nothing.
any discomfort?
No.
Perfect. What about when you urinate? Do you have any burning, any urgency, any
No.
discomfort?
All like usual.
Perfect, wonderful. So first, what I'm going to do, I absorb the abdomen of the patient, make sure it's not distended or red or concaved. The second thing I do is to auscultate, so listen to the abdomen, and I listen to the 4 quadrants for 50 seconds, and especially after surgery, we want to make sure it's active because of the pain medications can cause constipation. And I listen to the each quadrant for 15 seconds. And we are looking for 5 to 7 vowel sounds. Perfect. And it is active. Now I'm going to go ahead and palpate. Svetlana, I'm going to palpate your abdomen gently. I will skip over the wound because it will cause pain. I'm observing the patient's face to make sure they don't have any discomfort. Do you feel any pain?
No.
Perfect. And I'm feeling the abdomen for temperature. I'm looking for color and for any masses that I could feel underneath. Perfect, Svetlana. The next thing I'm going to do now, I'm going to go ahead and feel your arms, and please let me know, do you feel any pain?
No, nothing.
No pain. And I'm looking for temperature. I'm looking for if there's any swelling, any edema. And then here I'm going to go ahead and listen for the radial pulse. Do you have any tingling on your fingers?
No.
I'm looking for capillary refill, and it is normal. Go ahead and grasp my fingers, pull, and then push, and the strength is equal. I'm going to go ahead and do the same on your legs. Do you feel any pain?
No.
Any numbness? Wonderful. And I'm looking again for temperature, color, swelling. I'm gonna go ahead and listen to the posterior tibialis pulse, and then as well as the dorsipedis pulse. Go ahead and push my hands up, and then push my hands down. Perfect. I am looking, do you have numbness or tingles in your feet or toes?
No.
Perfect. And I'm looking for capillary refill. It's less than 3. Perfect. Go ahead and bend one knee at a time. Perfect. Another knee. Great. Are you okay when you walk to the bathroom? Do you have any problems or any assistive devices for
No.
walking?
No.
No. Perfect. Throughout this assessment, I am looking at my patient's speech and behavior. When I look at the back of the patient, when I listen to the lungs, I am checking for pressure ulcers in all the bony prominences, the head, the scapula, the elbows, as well as the back of the calves, the heels, the hip area. Make sure there's no pressure ulcers. Now, Svetlana, your pain, you told me it was level 3?
Yeah.
Yes, and what's your tolerable?
3 or 4.
Perfect. And I noticed your chart, you have medication just as needed for pain, so you can continue that at home.
I don't need to know. Thank you.
Perfect. And then because she has a wound, every time we come look at the patient, we want to assess the dressing, make sure the dressing is clean and is dry. And I'm gonna go ahead and lift it here so I can look at your wound. And if there's needed to do a dressing change, we go ahead and do that. We assess for the amount of drainage. We look at the skin, the temperature, make sure there's no heat or redness that could indicate infection. So it looks good, Svetlana. It's healing properly. Perfect. And I know you're gonna be getting discharged today, so you know when you shower, just make sure you don't get too much water, just gently, no rubbing on the wound. You have the pain medication as needed, and try to do as much walking as possible, just as you feel comfortable. Do you have any questions?
No, I'm good, thank you.
Perfect. So I'm gonna go ahead and give you your call lights. If you need anything, you can just call us. And then I'm gonna lower the bed to the lowest position. Perfect. Thank you so much.
Thank you.